Thank you. Welcome all of you. Welcome. Thank you very much. Our research was about the potential roles of superoxide dismutase, matrix metalloproteinase 9, and interleukin 18 in the prevalence and progression of type 2 diabetes mellitus. The research was done by me and supervised by Assistant Professor Dr. Shadarov Mustafa. Diabetes mellitus, as described as disorder of multiple etiology characterized by hyperglycemia with disturbances of carbohydrate, fat, and protein metabolism, resulting from defects in insulin secretion or insulin action or both. The effects of diabetes mellitus include long-term damage and failure of various organs. Because diabetes mellitus is a metabolic disease, its consequences affect most of body systems, and its complications is very wide. So, inflammatory process and oxidative status are two major systems that are affected by diabetes mellitus. Accordingly, this study was designed to compare serum levels of superoxide dismutase, interleukin 18, and matrix metalloproteinase 9 as markers of oxidative stress and inflammatory process in type 2 diabetes mellitus patients and comparing with healthy subjects. We have two main types of diabetes mellitus, type 1 and type 2. Type 1 represents only about 10% of diabetes mellitus cases, while 90% of all cases of diabetes are of type 2. Type 1, it occurs in childhood usually, and sometimes in adults, while type 2 usually occurs in adults. Type 1 is characterized by complete absence of insulin, so the patient should depend on insulin treatment for survival. While type 2, there is insufficient amount of insulin, or there is insulin but resistant to insulin. And treatment includes diet, physical activities, oral medication, and insulin. Diagnosis of diabetes mellitus. According to American Diabetes Association, depending on fasting blood glucose, fasting means not to eat or drink anything other than water for at least 8 hours. And this test is done usually in early morning before breakfast. If the fasting blood glucose from 70 to 99 milligram per deciliter, it's considered as normal fasting. From 100 to 125 milligram per deciliter, it's considered as impaired fasting blood glucose, or what's called prediabetes. From 126 milligram per deciliter and above is considered as diabetes. Here, the relation between diabetes mellitus, oxidative stress, and inflammation on molecular basis. A number of stimuli like hyperglycemia, circulatory free fatty acids, and chronic inflammation lead to increase in the production of reactive oxygen species, and this is lead to imbalance between oxidative oxygen species and antioxidant mechanism, and lead to oxidative stress. These oxidative stress lead to activation of two pathways, which is nuclear factor, kappa light chain activated beta cells, and inhibitors of these nuclear factor. And another pathway is C-Jun N-terminal kinase with activated protein 1. These two pathways are increase in the production of cytokines and acute phase reactants. Cytokines are interfere with insulin receptor substrate 1, which is the most important substrate for insulin receptor, and defects the action of insulin. So, insulin resistance results from cytokine production, which is the main cause of type 2 diabetes mellitus. Aims and objectives of the study. The first and most important aim of our study was to estimate serum levels of superoxide dismutase, matrix metalloproteinase 9, and interleukin 18 in type 2 diabetes mellitus patients and comparing with healthy subjects. Secondly, correlation between HbA1c, glycosylated hemoglobin, as an indicator for blood glucose level with the studied parameters. And third, correlation between studied parameters themselves. Finally, effect of other confounding factors like age and gender on the studied parameters. Patients and methods. A case-controlled study held on 50 patients with type 2 diabetes mellitus. 25 of them was male and 25 were female, compared to 45 healthy subjects. Patients were diagnosed at a diabetes center, and both groups were completed the baseline questionnaire. About the questionnaire form and exclusion criteria. Questionnaire form included questions about age, gender, weight and height, smoking, alcohol consumption, physical activities, chief complaints, other disease and medications. Exclusion criteria, the diseases that excluded in our study was hypertension, cardiovascular disease, cancers, all types of cancers, inflammatory disease like osteoarthritis, rheumatoid arthritis, ulcerative colitis, and any type of inflammatory disease, and renal diseases. Medications like lipid-lowering agents, anti-inflammatory drugs, vitamins, and antioxidants are excluded from our study. Obese, smokers, and pregnant women also excluded in our study. Protocol of the study: 10 milliliters of fasting blood samples were completed from the vein of the participants without using tourniquet. Sufficient quantity of the blood used for determination of HbA1c and fasting blood glucose. The remaining blood samples were kept for 30 minutes for coagulation purpose and then centrifuged for 15 minutes at 2,500 to 3,500 rounds per minute. The sera of the patients were separated and divided into several parts and kept in several plastic plain tubes to do the biochemical tests. And the sera of the patients were stored at deep freeze till the day of the analysis. The method of the detection of superoxide dismutase, matrix metalloproteinase 9, and interleukin 18 were measured according to the manufacturer's instructions by ELISA sandwich technique, and the statistical analysis were performed with SPSS version 18. Results. Here, as you see, the demographic characteristics between patients and control group. As you see here, that there is no difference in age and weight between patients and control group, while there is higher level of HbA1c as usual and fasting blood glucose between patients and control group, and the difference is significant. Regarding the difference in the serum level of studied parameters, first of all, superoxide dismutase. As you see here, that there is significantly lower serum level of superoxide dismutase in patients of type 2 diabetes mellitus as compared to control group. And this is maybe due to either direct effect of hyperglycemia on superoxide dismutase or exhausted superoxide dismutase due to the reactive oxygen species that increase due to hyperglycemia. So we can say that the oxidative stress that occurs in type 2 diabetes mellitus, it's not only due to increase in reactive oxygen species, it's also related to decrease in antioxidant mechanism. Regarding matrix metalloproteinase 9, as you see here, that there is significant higher serum level of matrix metalloproteinase 9 in patients with type 2 diabetes mellitus as compared to control group. And this is maybe due to increased thickness of the extracellular matrix, and as a compensate mechanism, there is increase in the matrix degradation enzymes in type 2 diabetes mellitus, or maybe due to oxidative stress that activates nuclear factor kappa light chain beta activated cells, and these lead to overproduction of matrix metalloproteinase 9. Regarding interleukin 18, there is significant higher serum level of interleukin 18 in patients with type 2 diabetes mellitus as compared to control group. This is also maybe explained due to increase in the oxidative stress that lead to overproduction of cytokines through NF-κB pathway. What's more interesting here is the link between blood glucose level and the studied parameters. As you see here, that there is significant strong correlation between HbA1c with all the three parameters. So as more as HbA1c is glycosylated hemoglobin and indicates blood glucose level. As more as HbA1c increase, lead to more decrease negative relation with superoxide dismutase and significant strong relation, more decrease in superoxide dismutase, so more oxidative stress. While as more as HbA1c increase, lead to more increase in HbA1 is in matrix metalloproteinase 9 and more matrix degradation. The same for interleukin 18. As more as HbA1c increase, lead to more increase in interleukin 18 and more inflammation. Regarding the correlation between the studied parameters, as you see here, that there is significantly strong correlation between all the three parameters. As we said, that superoxide dismutase is a defense mechanism. As more as superoxide dismutase decrease, lead to more increase in matrix metalloproteinase 9, so more matrix degradation and more inflammation, because as more as superoxide dismutase decrease, lead to more oxidative stress, so more inflammation and increase in interleukin 18 as a cytokine. While matrix metalloproteinase 9 is significantly correlated with interleukin 18. As more as matrix internal proteinase increase, lead to more increase in interleukin 18. Regarding age factor, as you see here, that there is significant weak correlation between age factor and the studied parameters. So the effect of age of the studied parameters in the population of our study was weak, because maybe due to all the patients or participants in our study was old age, so there is no big difference in the age variation between the participants. Or maybe due to the effect of blood glucose level is higher than the effect of age. So it's better, if you want to know the effect of age, to exclude hyperglycemia, because maybe a patient with 65 years with higher HbA1c have more effect than a patient with 75 years with lower HbA1c. Regarding gender effect, as you see here, that there is no significant different serum level of the studied parameters between males and females regarding interleukin 18 and superoxide dismutase. Only for matrix metalloproteinase, there is slightly higher serum level of matrix metalloproteinase in males than females. Conclusion and recommendation. The study revealed that there were significant differences in serum level of superoxide dismutase, matrix metalloproteinase 9, and interleukin 18 between type 2 diabetes mellitus patients and healthy subjects. There was significant lower serum level of superoxide dismutase in patients with type 2 diabetes mellitus as compared to control group, concomitant with significant elevation in interleukin 18 and matrix metalloproteinase 9 as compared with control group. There were significant strong correlation between HbA1c and superoxide dismutase, matrix metalloproteinase 9, and interleukin 18. It means as more as blood glucose concentration increase, lead to more oxidative stress and more inflammation. There were significant strong correlation between superoxide dismutase, matrix metalloproteinase 9, and interleukin 18 in type 2 diabetes mellitus patients. So, as more as antioxidant decrease, lead to more oxidative stress and more increase in inflammatory biomarkers and vice versa. The results showed weak effect of age on the serum level of the studied parameters. There were no significant difference in serum levels of the studied parameters between males and females, except for matrix metalloproteinase 9, which is slightly higher in males than in females. Recommendation. We recommend further studies with larger sample size to confirm and elucidate the present findings, and further prospective studies on the relationship between oxidative status and inflammation with the incidence of type 2 diabetes mellitus are needed to support this evidence. And finally, I would like to inform you that this study was accepted and published by an international scientific journal, which is American Journal of Internal Medicine. Thank you very much for your attendance.
Thank you, Dr. Shwan, for your presentation. We will start our debate now.